We see a lot less innovation in Medicaid versus what we see in a commercial setting. What that means for companies like mine is that Medicaid is a world of opportunity, a massive opportunity in terms of volume, a test bed for all kinds of innovation, right? Because innovation has been very slow on that side, but it is complex, right? And so it's really important to think about how you staff your team in a way that you'll bring in the knowledge capital, right, to be able to navigate the complexity that is Medicaid.
Welcome to Market Makers, the podcast where we explore the game changers and innovators shaping today's industries. My name is Troy Duffie. I'm Director of Financial Markets at the Milken Institute. And today, we're diving into the world of healthcare, technology, and maternal health. Our guest today is Maya Hardigan, founder of May, a company focused on addressing the alarming disparities in maternal health care, especially for Black women. May combines digital tools, data, and personalized care to empower women with the support they need during one of the most critical times in their lives, pregnancy and childbirth. Maya is here to talk about her journey, the vision behind May, and how technology is being used to close gaps in care and improve outcomes for women everywhere. It's going to be a fascinating conversation. Let's get started. Hi, my name is Troy Duffie. I'm Director of Financial Markets at the Milken Institute. I work on inclusive capitalism. That means the economy should work for everyone. We have this moniker that we should use finance as a force for good. And so I'm super excited to be on the podcast with you all today.
Always amazing to work with you, Troy. I'm Lenore Champagne-Beirne. I'm the founder and managing partner at Bright Ventures, where we use coaching, community, and capital to build an inclusive economy. And I spend most of my time as a VC investor in early stage startups.
Awesome.
Today we are joined by Maya Hardigan, who is the founder of May. Maya, we are really excited to talk to you today because May is addressing such an important issue, and we have so much excitement and respect for the work that you've done. For those who might not know who are listening, as of 2021, CDC research indicated that the maternal mortality rate for Black women was 2.6 times, almost 3 times the rate for white women. Today, we'll explore how Maya, this amazing innovator, is building a digital maternal healthcare platform that addresses that issue. Maya, we're really excited to hear a little bit more about you and May.
I'm so happy to be here. Thank you for having me.
Absolutely.
Maya, why don't you tell us a little bit about yourself, how you got started?
Yeah. So I'd love to introduce myself. I have been working in healthcare now for a full 20 years. I had a long career in healthcare prior to making this pivot to found May. Most of my career, just to give you the quick background on my professional experience, I started in healthcare management consulting 20 years ago out of business school, and then I spent over a decade at Pfizer, primarily doing work that focused on healthcare access, digital innovation, lots of different channels for getting to patients, getting to individuals where they were and helping them to better engage in their care. And I led an innovation platform at Pfizer that focused on just that for many years. There were a lot of learnings there. A lot of them are coming full circle in the work that I now do with May. But importantly, I'll also point out during that time that I was doing quite a bit of maternal health nonprofit work, and specifically a lot of work that focused on maternal health access for individuals who were underserved, right? And these were disproportionately Black and brown mothers, but also disproportionately interventions that really worked in maternal health care, right? And so I think I had this nagging voice on my shoulder that said, why are so many Black and brown mothers without these very basic supports in maternal health care when we know that they work, when we know that they return positively in terms of clinical and financial ROI? And so that was something that really bothered me. And then what also happened during that time is I was starting my own family. So I'm a mother of 3 girls. I went through this experience as someone who was incredibly health literate by nature of my job, but also someone who had great health insurance. I had all 3 of my babies while I worked at Pfizer. And I had all of the resources that I should have needed at that time to really thrive in my pregnancies, right? And I still faced quite a bit of marginalization in my own care that was really hard to explain away, right? Wow. And so fast forward, it was really in the summer of 2020, when, I think we were all in a very particular and deep emotional space, right? And I made the decision that summer to really pivot and focus my career a little bit more on the social impact aspect of my work. And it was really then pivoting to focus on maternal health innovation and access, and particularly with an emphasis on the needs of Black mothers. And so I founded May at that point. At least I started thinking about it in concept at that point. I didn't know what that meant for me, right? What I would say is that it was really important to me to not found a startup that was recreating the wheel, right? We know that certain community-based interventions work, and they work very well. I spent a lot of time thinking about where I could be additive if I was going to pivot my career in that direction, right? And where I decided I could be additive was really leveraging a lot of experience I'd had for the better part of 2 decades working with healthcare executives, trying to make the case for certain investment decisions, driving forward innovation in that regard, right? And so May focuses very heavily on building upon those clinically established interventions, but importantly, working with large healthcare insurers, large healthcare payers to bring more of those services and access to our most underserved mothers, and specifically Black expectant mothers who are suffering meaningfully when we think about these disparities in outcomes.
Yeah, I mean, the problem is unfortunately so clear, so well documented, and so widely experienced by Black women. And I think that means also it merits a really nuanced solution. Can you say even just a little bit more about where May shows up in the market and how that extends your impact?
Absolutely. So we primarily show up in the market in Medicaid managed care, right? And so when we think about Black maternal health disparities, they are pervasive. They impact all of us. I think it's very important to say that when we think about the experiences of Black mothers, they are variable, right? We're not a homogenous group. We are a very diverse group. I was not an individual who had my children covered under Medicaid insurance, right? But I think that it's also important for us to innovate with a lens towards access for the broadest number of individuals, right? And so when we look at Medicaid, it is actually the primary payer of Black births in the U.S. and a primary payer of all births in the U.S., right? Funding about 40% of births each year, but for Black mothers funding upwards of 65% of births, right? So it was really important to me in founding May and really approaching it with a lens towards equity and access and the needs of our most underserved that we built for Medicaid. I will say that, having focused exclusively on Medicaid over our first 2.5 years or so, we are now thinking about how we, target and tackle the other 35+% of Black mothers who are in need. And we are exploring now some commercial channel partnerships, opportunities in other spaces, but Medicaid is really our bread and butter and where we want to be in terms of being able to touch and reach the most Black mothers.
2 questions come to mind for me. One, I would love for you to take the audience through that payer system, right? I didn't have a full understanding of Medicaid and a Medicaid payer system, managed care, et cetera, until I did a deeper dive in my former life as a VC on a healthcare venture capital firm. And so I would love if you could take the audience through that perspective.
Yeah. Medicaid is complex and it's very nuanced is what I would say, right? Unlike Medicare, which operates at the federal level, Medicaid operates at the state level. And very often people who work in Medicaid say, if you know one Medicaid state, you know one Medicaid state, right? A lot of diversity in terms of what is covered by way of benefits, how those benefits are covered, what claims codes to use, what autonomy different insurers have in how they deploy particular plan offerings and benefits, right? And so Medicaid is complex from that perspective. How that translates, I would say, into innovation is that there's much less, right? We see a lot less innovation in Medicaid versus what we see in a commercial setting. What that means for companies like mine is that Medicaid is a world of opportunity, a massive opportunity in terms of volume, a test bed for all kinds of innovation, right? Because innovation has been very slow on that side, but it is complex, right? And so it's really important to think about how you staff your team in a way that you'll bring in the knowledge capital, right, to be able to navigate the complexity that is Medicaid. And that's been hard for us, right? I think we're learning over time that it serves us much more to learn one market, go deep in that market, learn the next, go deep in that market, learn the next and go deep in that market versus spreading so thin.
Okay.
I'm so grateful that you're calling out the opportunity of Medicaid, because I think as a digital health investor, I often hear founders kind of assume that the commercial side is where the money is, because the people have more money, right?
Yeah.
And this is a really mistaken assumption when you look at the volume of people who are covered. So I really appreciate that and the nuanced approach to actually bringing something to market in that space.
And Medicaid, there's certainly money there, right? Reimbursements are very often less than they are in Medicare and also less than they are in a commercial setting. But there is a volume game, and there is also a lot of opportunity to innovate around value-based contracting, right? And so Medicaid plans do tend to operate on a relatively thin margin. If you show the value, if you show the impact to their membership, there are various approaches for being able to share in that value, right? And so I think that also underscores the point I made about making sure there's someone on your team who knows how to navigate that and really just learning over time.
Thank you.
Tell us a little bit more about the product itself that you provide to the market and how that helps impact mothers.
And so this is where I think that my management consulting background served me very well, because when I started thinking about May and where we could and how we could make the most impact, it really did focus on a starting point of understanding what clinical interventions work, right? What works in digital health, what works at the community level. Again, the goal is not to recreate versus bringing the most impactful things together and working towards putting more of them on a path to reimbursement and getting more of them in the hands of Black mothers, right? And so when we think about our product, we really built in that way. There are 3 key areas of focus for May, three core tenets of our offering. One is work that we're doing to focus on earlier and more continuous risk identification for Black mothers, right? So helping to flag for physical risk factors, mental health red flags, but also very importantly, a continuous view on social determinants of health, right? Those health adjacent considerations that impact one's ability to engage in their own care. So thinking about things like transportation, right? Thinking about healthy food access, housing security, all of these sorts of things, and working with our insurance plan partners to help moms address those needs sooner and more meaningfully through benefits coordination, through social support, and the like. The second core tenet of our offering is work that we're doing to bring more community-based doulas of color into Medicaid participation, right? So doulas, they've been heavy in the news over the past many years, right? We know that they are an established intervention around specifically some of the disparities that we're hoping to move the needle on. So thinking about non-medically indicated C-sections, thinking about mitigating preterm birth, low birth weight babies, sometimes very early preterm births that impact our children's ability to develop normally and thrive over the course of their life. Doulas have been shown to meaningfully impact these things and many others: breastfeeding, success and duration, healthy recovery postpartum, or awareness if something's wrong in that postpartum recovery period, right? And so doula participation in care is a big focus for us. And the third tenet of our offering really focuses on virtual group-based education. And this is really something that was born out of feedback from our users in 2023, where they said, hey, May, there are certain areas where we still have gaps in our care or experience, or we're not getting adequate support from our core care team, right? Helping us to think about advocacy in pregnancy, helping us to think about healthy nutrition, exercise, mental health, self-care, all of these sorts of things. And so we've offered and built over the past year really a rotating group of courses that are led also by Black maternal health experts, right, on exercise, nutrition, mental health, symptom awareness, preparing for labor and delivery. Our moms love these, right? So those are really the 3 core tenets of our offering. It is the digital risk tracking, it's the community-based doula support, and it's the virtual group-based education.
And what do those translate to in terms of outcomes so far?
So far, solid outcomes, but outcomes we also would have expected, because again, we know that these interventions work for Black mothers, right? And so our outcomes up until this point they've been incredible, right? When we think about the 2 most pressing concerns, right, around C-section rates, which are important not only because they drive costs, but because they also drive downstream health complications for mom in recovery. And I say this as someone who was a three-time C-section mom myself. Sometimes they're medically necessary, and oftentimes they're not, right? We estimate that about 50% of C-sections that occur were medically necessary and 50% were not, right? So far for us, we've had a 30% reduction in C-section rates from baseline statistics nationally for Black mothers. And importantly, on the preterm birth rate, we have also been able to show for many of our plans an upwards of 30% reduction in preterm birth rates for are mothers relative to baseline statistics for Black women, right? And so obviously, as I said, the ramifications of this are massive, right? Mm-hmm. It's cost to the system, but more importantly, it's the human impact, right? It's mom's ability to recover and thrive and return to full productivity in society, workforce participation, all of these things, when Black women often are, right, really at the core of families, right? And so that's always very important. But when we think about preterm birth rates, again, they're all very often long-term ramifications to our children, right? And in some cases that lasts for their lifetime. And so that is also something that we're very proud of, but again, not surprised by.
Yeah. I'm curious, last question, Lenore, it was so important that this topic was covered under the banner of inclusive capitalism.
That's right.
Why do you think that what she's covering is so important around that banner?
Well, gosh, I think you just spoke to a really core piece of it, Maya, which is that Black women have long gone unrecognized as the incredible fabric of our economies, our families, our communities in so many cases. And to be in that group and have that group also be so vastly under-resourced, particularly at one of the most vulnerable and important moments in their life, I think is a real problem. So I am incredibly and eternally grateful for the work that Maya continues to do. Maya, thanks so much for joining us.
Thank you. Thanks for having me. This was a fun conversation.
That's it for this episode of Market Makers. A huge thank you to Maya Hardigan for joining us and for sharing the inspiring work that she does at May to tackle inequities in maternal health care. And a friendly disclaimer, May is a portfolio company of Bright Ventures, a fund that I manage. If you enjoyed this episode, be sure to subscribe, leave us a review, and share this episode with others who are passionate about healthcare innovation. You can follow us at ImpactAlpha and wherever else you stream podcasts to stay connected and hear future episodes where we speak with other industry leaders and change makers. Thanks again for tuning into the Market Makers podcast. I'm Lenore Champagne-Beirne, and I'm reminding you today that innovation in healthcare has the power to transform lives, and May is showing us how.